Meet Mr Oghieraki Endurance, a maintenance engineer with a top oil servicing firm in Nigeria, who was brought to Region Stroke and Neuroscience Hospital unconscious on the 8th of May 2020. As at when he arrived at the hospital, he was with a day history of loss of consciousness. CT scan done showed he had a bleed in the brain, known as Basal Ganglia Haemorrhage. He was immediately taken into Region's Healthcare Intensive Care Unit, and we considered the best option in taking care of him. The consensus eventually was that he was going to benefit from surgery, which would involve the removal of the hematoma which he had in the brain, and taking care of the complications that might ensue. He was taken into the theater the following day, and we did what we call basal ganglia hematoma evacuation with craniotomy and skull lifting. Patient was stable after surgery and was transferred immediately to the ICU. He was managed in a neuro-intensive care unit for a length of time. During the course of the management, we battled a whole lot of change in blood pressure, blood sugar control, and generally neurocritical care. With progressive improvement, we began to wean him off a couple of antibiotics. His hospital stay was also complicated by a condition called central fever, which was adequately taken care of. He was eventually transferred to a step-down intensive care unit. During the course of the management in the neuro ICU and step-down ICU, he was having regular neurorehabilitation. Subsequently, he was transferred to the ward and also later enrolled in our neurorehabilitation program, where he spent a couple of months and was able to attain a reasonable length of power in the weaker side. Wound healing was optimal, and patient had progressively done well. At the moment, he can use his walking stick to ambulate, and his quality of life has tremendously improved.